My topic is cystic fibrosis. What exactly is cystic fibrosis? It's a life-threatening disease genetically inherited, affecting the lungs, pancreas, liver, intestines, sinuses, and sex organs. It's characterized by a buildup of thick, sticky mucus. In the lungs, this mucus blocks the airways and makes it very easy for bacteria to get stuck, leading to many serious respiratory infections which do major damage to the lungs over time. After enough time, this unfortunately causes respiratory failure. In the pancreas, the mucus blocks the ducts where the digestive enzymes are released, and it stops them from reaching the small intestine. This means that a person with CF will not be able to fully absorb fats and proteins, resulting in them being nutrient deficient. Subsequently, this leads to heavy stools, intestinal gas, constipation, and much discomfort. Lastly, in the liver, bile becomes thicker and stickier than usual, leading to blockages of the small bile ducts. This causes damage and scarring of the tissue, which is known as biliary fibrosis. Over time, the fibrosis spreads throughout the entire liver, resulting in the hardening and therefore decreased blood flow. So the only way for people to inherit cystic fibrosis, since it's a genetic disease, is by receiving 2 copies of this defective gene, one from each parent. This gene is on chromosome 7 and is called the cystic fibrosis transmembrane conductance regulator, or CFTR. People with only 1 copy of the gene are called carriers. When 2 CF gene carriers have a child, the chances are 25% that the child will have cystic fibrosis, 50% that the child will not have cystic fibrosis but will be a carrier like the parents, or 25% that the child will neither have cystic fibrosis nor be a carrier. So the chances are high that the gene will be passed down. The way this works is in people with cystic fibrosis, the CFTR gene produces defective proteins unable to perform their job. In a normal cell, like the cell on the far left, the protein is able to move to the cell surface and allow for chloride ions, water, and other small molecules to pass through. Instead, when someone has the faulty protein, it either can't move to the cell surface like the cell on the far right, or it moves to the surface but won't allow anything in. These are known as the door jamming mutation and the common delta F508 mutation. This disrupts the chloride and therefore salt transportation and reabsorption in sweat glands. This also causes mucus on the outside of these cells to build up and become especially thick and sticky without the presence of water. When the mucus lining the airways and the respiratory tract gets to be like this, it restricts the movement of the cilia, stopping them from cleaning the respiratory tract, resulting in a mucus plug and complications during breathing. Similar situations happen in the pancreatic ducts, where the digestive enzymes are released from. So if there's one thing I've learned from doing all this research on cystic fibrosis, there are a lot of signs and symptoms. So they had to be classified in respiratory and digestive. So for the respiratory symptoms, there's persistent cough that produces a thick mucus, which, like I said before, the thick mucus is that defining characteristic of cystic fibrosis. There's also wheezing and shortness of breath, because as I mentioned before, people with cystic fibrosis have that buildup in their lungs of that thick mucus, and it really causes them to have trouble breathing. Respiratory illness, such as bronchitis and pneumonia, because the bacteria that get stuck in that thick mucus causes a lot of respiratory infections. Exercise intolerance, because the people with cystic fibrosis have a hard time exercising because they get fatigued very easily from the nutrient imbalance and deficiencies and the fact that they have trouble breathing. And lastly, inflamed nasal passages or like a stuffy nose is also another sign and symptom of cystic fibrosis. As for the digestive signs and symptoms, there's foul-smelling, greasy stool, which is just downright disgusting, poor weight gain and growth, intestinal blockage, and severe constipation. Other symptoms include salty tasting skin, delayed sexual development, absence or stopping of menstruation, irregular periods, inflammation of the cervix, or infertility or sterility. So when doing all this research for cystic fibrosis, one of the questions I had was, how do people get diagnosed with cystic fibrosis and how early can they be diagnosed? Because it seems like a very devastating disease if gone untreated, but it seems like there's so many signs and symptoms that it would be easy to figure out. So the answer to that is very simple. All states have mandatory newborn screening using a genetic test or a blood test. The genetic test tests for the faulty CFTR gene, while the blood test tests for the function of the pancreas. However, like most diagnoses of disorders and diseases, tests are done more than once, or a battery of tests are used to confirm the initial suspicion. With CF, the sweat test is basically the second opinion. Once a newborn tests positive in either of the aforementioned tests, a sweat test is performed to definitively diagnose a person with CF. However, this test can't be done until a newborn can sweat enough for the test to be performed, which happens at 2 to 4 weeks old. This test essentially tests the salt content in sweat because, as mentioned before, there's usually a buildup of chloride ions and therefore salt in a person with CF skin. So the test would test positive for excess amounts of salt, confirming the suspicion that they have cystic fibrosis. However, there are many other ways to diagnose CF as well. There's a chest x-ray, which essentially allows the doctors to look at a patient's lungs to see if they're inflamed or scarred. There's lung function tests, which do exactly what they sound like. They just check to see how efficiently your lungs deliver oxygen, as well as simply checking how much and how quickly you can breathe in and out. There's simple CF carrier tests to just see if you are a CF carrier, so you can make the changes accordingly whether or not you want to have kids, because the chances are that they're either going to be a carrier or have CF themselves. And then lastly, there are prenatal screenings to see if your unborn child has CF. Alright, so currently there is no cure for CF at the moment. However, there are a lot of treatments and therapies that can help ease the discomfort of cystic fibrosis as well as improve the quality of life. So the first technique is called an airway clearance technique, or an ACT. It's similar to burping a baby. It's just like tapping the back or the sides along with coughing in order to get rid of the thick mucus. Then there's mucolytics, which is inhaled medicines to loosen the mucus in the lungs. An example of that would be pulmozyme, which acts like scissors to cut the strands of DNA that make the mucus so thick and sticky. There's a nebulizer, which is a machine that administers a mist of medicine into the lungs. There's the addition of vitamins and mineral supplements into the diet, which aids in the malnourishment factor. And then there's lung transplants. That's kind of a last resort type option because there's a lot of risks and a lot of things you need to think about before going through with that procedure. But then recently, there have been CFTR modulators, which are pills that people with cystic fibrosis can take, that they can take in order to correct the CFTR defect. Calideco, which is ivacaftor, works in the lungs to move salt and fluids into the airways, which thins the mucus built up. Orkambi, which is a combination of ivacaftor and lumacaftor, works in a two-step process to move the defective CFTR protein to the surface of the cell and then increase its activity. So should people with cystic fibrosis exercise? And the answer, as always, is of course, because exercise is medicine. But what specifically are the benefits of exercise? Well, there is an improved tolerance to exercise, obviously. There is increased lung capacity, which is helpful for someone who has trouble breathing. Improved life expectancy, which is crucial because there's the statistic that people with cystic fibrosis don't typically live past their mid-30s, so this might improve their life expectancy. It can also help clear mucus from the lungs, making it easier to breathe, which is very helpful. And then the last one is probably the most important, which is better fluid balance, which is decreased loss of salt due to the sweat gland dysfunction that I mentioned before. So basically, exercise can help them not lose as much salt as they normally do because since they have so much, when they sweat, they lose 3 to 5 times more salt than the average person. So it's very crucial that they exercise to improve their fluid balance. So for my case study, I have Paul, who's a 20-year-old male who is 5 foot 8 inches tall and 135 pounds, which is a BMI of 19. He has a resting blood pressure of 108/66. He was a smoker but quit 1 year ago and has no family history of heart disease. His fasting glucose is 90 milligrams per deciliter, total cholesterol is 180 milligrams per deciliter, and his HDL levels are 30 milligrams per deciliter. Paul was diagnosed with cystic fibrosis when he was a newborn, and despite that fact that he has trouble breathing at times, he still plays baseball, ice hockey, and golf. So for Paul's risk stratification, I had him at one negative risk factor because he has cystic fibrosis, which technically is a pulmonary disease. So he is still considered low risk though. So when prescribing exercise to the population of people with CF, it is important to remember a few things. For one, it is much more difficult for them to breathe than the average person due to the increased viscosity of mucus in their lungs. This will cause them to be out of breath easier than most people. Also, people affected by the disease lose 3 to 5 times more salt than non-CF people do when they sweat, which I mentioned before, making it crucial that they stay hydrated at all times, especially during exercise or in warm environments. Lastly, it is a known fact that people with CF can easily be lacking nutrients due to the blockage of their pancreatic ducts, preventing the release of digestive enzymes to the small intestine. When training a client with CF, it is imperative that the client is made aware that they must be eating balanced meals as well as potentially taking vitamin supplements. However, most of them have probably met with their doctors and know where they are vitamin deficient. So for my client Paul, his goals are to just increase aerobic endurance, gain strength, and maintain a healthy body weight. So as for exercise testing, why is it so important for people who have cystic fibrosis? Well, it's very important to test the populations of people who have diseases and disorders that affect their cardiorespiratory system. Knowing how they handle the stress of exercise is key in determining their exercise prescription, not just in the sense of aerobic capacity, but also how their bodies cope with possible nutrient deficiency, as well as the loss of excess salt from sweating. People with CF are known for losing energy more rapidly than the average person, so before having them start a routine, an exercise professional must know their limits, as well as establish a baseline to monitor their progress. So as for what tests to use for an individual with cystic fibrosis, I came up with 3. So the 6-minute walk test, the 3-minute step test, or an incremental shuttle test. All of these tests are used for populations with chronic cardiac and respiratory diseases. We could do a max test, but all these are good indicators of max values without stressing the body of the patient too much. And like I mentioned in the slides previous, people with cystic fibrosis have very low energy levels when they're exercising, so it's probably best to use a submaximal test. As for the actual exercise prescription, I broke it up into aerobic training and resistance training. For aerobic training, I have the frequency being 3 to 5 days a week, intensity being 40 to 60% of heart rate max, but since my case, Paul is an athlete, he can increase the intensity. As for time, I have him at 30 to 40 minutes, and then the type would be running, but not in hot environments. As I mentioned before, that's a risk factor for CF people because they get dehydrated easily. He could do cycling or swimming, which I think is the best option because it would reduce the chances of him sweating. In terms of resistance training, I also have the frequency at 3 to 5 days a week. I have intensity based on the 6 to 20 RPE scale, so I have it at 14 to 17. But he can also increase that because he's an athlete, and I have it at 8 to 12 reps and 3 sets per exercise. For the time, I have 30 to 40 minutes, but it could be anywhere from 8 to 10 different kinds of exercises, and the types of exercises would be ones that use multiple muscle groups. So, in conclusion, cystic fibrosis is a potentially devastating disease caused by thick, sticky mucus. It causes defective proteins to be made and excessive amounts of mucus to block ducts and airways. There is no cure for CF, but there's a whole lot of treatments that can make life easier to deal with and the symptoms easier to handle. It is very important that people living with CF drink plenty of water and include excess salts in their diets. And most importantly, exercise will improve the quality of life because exercise is medicine. Thank you for watching, and I hope you learned a little something.